time. We are today, I'm Baba Rao. Most of you know me. If not, I'm a dermatologist in New York, and I teach at Cornell and Rutgers in the area. And then we have our guest or our special speaker today is Professor Aamer Ikram. We call him Professor. He has other titles. He also happened to be a general in Army, but his title is a Professor Aamer Ikram. He is currently a director of NIH, which is National Institute of Health in Pakistan. And then he has obviously done MBBS and a FCPS and a PhD, and has published several relevant papers in his field. But really, most importantly, when we think of Aamer right now and thinking about future of healthcare in Pakistan, we feel at this time we are at the right stage, and I think Aamer is doing wonderful things in reference to NIH and improving healthcare in the country. Especially, you all know that we co-produced the vaccine, and in Pakistan, a vaccine is available, and almost most people can get it, whoever wants it. I'll come back to Aamer. Our other panelists, we have Dr. Farid Sori, most of you know. We have Dr. Sarwat, and we have Dr. Bhutta, who is also on the board of directors for NIH, and we would love to have him every time. And Dr. Fiza Gilani, Dr. Baidullah Malik, who always have excellent comments because he holds certain I'll say certain strings which we need to talk to him to get things done. And then Shahid, who's our co-chair with me for Merit. Danish is not here, or Danish actually is coming. He said he may not be here, our Merit chair. And then Uzair, who's our Google for all our Google for all these meetings, who knows everybody. He know how to get things done, and he know how, if you fail, what do you do? And he has a lot of that experience. Without him, we were not really disconnected with Pakistan and internationally with Pakistani graduates. So I think with any further delay, I would just like Professor Saab or General Saab, Aamer, please get started and tell us what's happening with NIH and where we may be going.
Bismillah ar-Rahman. Thank you so much, Dr. Baba. It's really a pleasure to be among you all. And as I know, I'm familiar with most of you, it would be great to talk about the National Institute of Health, but definitely looking forward towards more interaction in the near future. I'm sorry, I'm at a marriage ceremony, so don't mind the color of this my screen. I'm not that bad or that old as I'm looking right now. Let me share my screen firstly. Aapke saath.
While Aamer is doing that, I'll take 1 minute to remind everybody it's a CME program. You can get CME credit. This is approved and sponsored by Merit, which is one of APPNA's wings. So thank you to APPNA and Risa. Go ahead, please.
Right. Thank you so much. Bismillah ar-Rahman ar-Rahim once again. And National Institute, what I'm going to do is give you a little bit of past, present, and future of National Institute of Health, where I am working right now. I'm there for the last 4 years. And this is the non-disclosure statement, as you can see. We do. Now, since its inception in 1967, the Institute has been performing in various capacities like public health services, surveillance, diagnostics, more so related to the public health labs, vaccine and sera production. There's a food and a drug testing department, and definitely the development of various human resource directly related or indirectly related to the public health. This will be the sequence of my presentation. Now, as in the recent past, we are an autonomous body coming under the Ministry of National Health Services Regulation and Coordination, underneath which there is an executive director. Mostly it comes through the system or has been on deputation. Previously, the retired lieutenant generals, especially the Surgeon General, have been coming off and on. And underneath the executive director, there are technical divisions, there's an admin and finance section as well. The various divisions include the Public Health Lab Division and Field Epidemiology Division. And these two are taking the main brunt and chunk of the public health work. Then there's a Biological Production Division, looking after the vaccine and anti-sera production. I'll be giving you the details later on. The Drug Control and Traditional Medicine Division, followed by the Nutrition Division. So there are 5 divisions in all. And then there is the College of Medical Lab Technology along with an allergy center. The Public Health Lab Division advises the federal government on various aspects of communicable diseases. Up till now, the non-communicable diseases are directly resting with the ministry itself. And I'll be talking about what's happening in with the new ordinance now. Now, it supports all the public health related matters related to outbreaks and investigation being followed by the Epidemiology Division. It also has a regional polio center. Now, this is an excellent thing that exists with NIH. We have 60 collection points for polio from the environments, basically the sewage samples, and 20 within Afghanistan. We are trying to increase the number. And also we are putting it together with all the enteropathogenic surveillance, because some time back with the Gates Foundation, we started off with the Vibrio surveillance. We're already well versed doing this genomics for COVID, and polio has been the hallmark. Unfortunately, still existing in the country, but the lab definitely utilizes ours. The Field Epidemiology Division basically, as I said, just gathers, analyzes all the data, and I'll give you detail that how we rejuvenated this one. It was quite a redundant sort of department the time I joined. And the mandate has been huge. I mean, if you see NIH, if you see the Epidemiology Division, it is responsible for international health regulation, coordination, then One Health, followed by antimicrobial resistance, followed by global health security agenda, all rests with NIH. So it is a federal mandate. Now, this gives the strength to the system under the 18th Amendment, whereby the teams can work with the various partners in provinces as well as regions, including AJK and Gilgit-Baltistan. We have a workforce development program. In particular, I'll be talking about the FELTP program as well. The Biological Production Division, as I said, is responsible for sera production as well as various vaccines. As you can see, the rabies vaccine, measles, typhoid, cholera, combined tetanus toxoid, and others. The drug control, basically, it is the sole appellate court for the country and stands responsible for all the narcotics and other concern issues resting with the government side or even from the non-government side. It was in 1979, it was given the pride through the nothing less than the President of Pakistan to be the center of excellence. Unfortunately, over the years, it didn't come up to that level after that. There is a nutrition division basically responsible for setting up the standards and policies. Fortunately or unfortunately, there is a separate department of nutrition resting with the ministry. And that's what we have been requesting them for amalgamation and joining the strengths together. We are trying to rejuvenate this. We could procure certain equipment, latest equipment, and because this is a published analyst lab, not only for Islamabad, but also for AJK and GB. But we do provide guidance to the provincial labs as well. Allergy center, I mean, it's something some of you may not agree to the concept of, but it's a time older. And what I have seen over the last 4 years, there's a huge dependency on allergy testing in this center. The good thing is that we extract the local allergens. We are not importing anything. And last 4 years, we are trying to refine those allergens and add more so that we can have a better idea of existing local allergies. And now, based upon the request, we are also working for another center in Balochistan as well, because the patients are coming from far off areas of Balochistan. We have a College of Medical Lab Technology. This was the first ever in the country, established in 1976. And we are having BSc honors, 30 students per year. This program is affiliated with Shaheed Zulfikar Ali Bhutto University. And then we also conduct this FSc in medical lab technology as well. And surprisingly, there's a demand in the country now. Now, once I joined the work, we started working on how to augment the system. So objective that we laid down was strengthening the existing system at that time, rejuvenating the team, curtail the unnecessary expenses, increase the functionality, and that was the main thing. And today I can say, I take this alhamdulillah respite that after the corona, during the corona crisis, and still we are into it, we are not out of it, that we could get extraordinary work out of very ordinary teams. But it was just because we rejuvenated them over the last 4 years. And it needs to be a true referral center for the government and for the nation as well. The principles that we delineated were achieving the sustainable development goals. As you all know, we previously failed in attaining the Millennium Development Goals. One of the good things was that Pakistan was the first country in the region and third in the world undergoing joint external evaluation. It's a whole complete, huge document. And what I did in my early days, I started working because it was a complete SWOT analysis. And based upon that, we started working and filling up those gaps which were depicted in this excellent report. We want to provide definitely better healthcare facilities with optimal utilization of trend. Now, this has again been a dilemma. I mean, there were some good people as well, but their utilization was totally in the wrong direction. And definitely after all this, adding new heights to the system. Now, this used to be our previous mandate, and we again, I myself analyzed what were the areas which were deficient. There was some like developing an infectious tropical center or dissipation of knowledge to the periphery, especially the provinces, and they were missing. The National Virus Reference Center has been there. Unfortunately, fortunately, it's basically a WHO qualified center, collaborating center for viral diagnostics. Similarly, there were areas where we needed dire attention. Most important was the biological production department. And there were some areas where hardly any work was done. I don't want to give you the details and bother you. So what we did was basically we started off with the merit-based inductions. And till now, in the last 4 years, we have done 3 inductions on the government sector, but we've got a good number of project-based human resources as well. And what we concentrated was not only training within the country, but sending them abroad, like fetching them CDC courses for 3 to 4 months, and so many other opportunities. And before the COVID, there was hardly any month where we were not conducting some training inside NIH or sending our people abroad to different parts of the world for gaining the access, training, expertise, and bringing it back to the country. What the finances, basically what the government gives us a yearly grant, which just includes the pays of the staff. Then there are projects which I'm going to explain you how we get these project-based grants. Then there are donor funded like CDC and others, and some are in kind like Public Health England. Now, what we have done basically through the Planning Commission, this is the form where we get the governmental front. The previous 3 projects, main project, there were so many others, but the main was Sera Processing Lab, upgradation of the measles vaccine plant, and upgradation of a filling line to totally new filling line. Now, would you believe the Sera project was started in something like 2004 and could not be completed in 17 years. So once I joined, we picked up the gear from again, we reassessed the cost escalation from 147 to 751 million, got the approval from the government after a lot of struggle. And within 1.5 years, we completed this project alone. This is the place where we have redirected it for co-production of COVID vaccine. But side by side, it's continuing its basic purpose. Similarly, the measles plants, which was shut down for 7 years, we rejuvenated that. And the last one, inshallah, it will be shortly completed again. And we'll be having another filling line system at NIH. So the strategic vision, I think that's the most important, how to strategize all these things. Let me share, it has been not an easy journey for the last 4 years. It's been very tough because on the one side, we have to finish all the previous project. On the other side, thinking about the present and then delineating the line of action for future as well. We started working on integrated disease surveillance and response with Public Health England. We piloted in the province of KP, and 3 years earlier, we brought it for piloting in Islamabad. And today, alhamdulillah, this system spans all across the country. I'll give you on the slides later on. we wanted to work on provincial integration because of the 18th Amendment, autonomy of these provinces, especially for health. It was very difficult. But what I realized that neither NIH was providing any platform, nor the federal government was giving any option to the provinces. So what we prepared that platform with a lot of hard work, and the provinces started looking towards us. And how we did, I'll just explain you later on. There were issues related to legislation, neurodiagnostics, and meanwhile we got it approved as National Public Health Institute. Now we are part of EANFI, which is the International Association, and fortunately I happen to be the member of their executive board as well. If you see the on a larger picture, around 7% of production of anti-Sera and vaccine is going on in the country. I'll just briefly explain about the public-private ventures and the ongoing, as you see down the line, we have formalized all these things is the implementation of international health regulation and global health security agenda. We have the roadmap developed for that. And fortunately, Alhamdulillah, Pakistan now is in the steering group of GHSA, which just includes 5 countries. And it is all with our continuous effort that we could, after the joint external evaluation just in 2016, we could reach that level that not only we were selected, but we are also part of their steering board. Then the One Health, and we have worked very hard based upon that, and that also is included in the integrated disease surveillance and response system. And finally, the strengthening of the point of entries, which are 19 in number, and we have been working very hard, sending our teams for the trainings at seaports, airports, and ground ports as well. We personally, I did draw very hard timelines for myself and my team for the 3 years. And Alhamdulillah, today, I would say we have gone much beyond what we thought at that level. I'll be briefly sharing some of the accomplishments with you. That I truly believe you need to provide your staff a very sort of an atmosphere where they can deliver as well. Some of you might have visited in the past the different areas, and every place was almost rusty and giving a very bad look. So we started with the renovation works. We started for uplifting of, it's a huge area of almost 800 acres. And we started with the completion of the pending projects. As I just told you, 3 of them you've just seen, and these have been the mega projects, not completed for years and years. And then what I did, I was made in charge of TB/AIDS malaria program as well. I could save $5 million from there. And what I did was that I requested the Global Fund that we need a state-of-the-art warehouse, and it is being established. I hope some of you come down. Whenever you come down, we'll take you around to all this. Then we allocated land for very important, like now there's going to be a technology hub within NIH. Now that's an area where APPNA can focus of either investing or bringing in ideas. And I'm sure that will be very, very versatile. Then a new infectious disease hospital has been set up within NIH, and I've been part and parcel of its construction. DRAP has also been allocated, and I hope that they start their buildings establishment as early as possible. Now, for the first time, what we did was preparing a master plan. There was none existing for almost 50 years. So I got a hold of services of different governmental departments, and the one of the round area that you can see over here on the screen, that's what we need to be converted into a health hub. That's making a park free of cost for everyone, providing all those facilities for gymnasium and that. That's what we desired. I've been discussing with the finance secretary and as well as health secretaries, but that's the area which we need definitely dire funding. Now, we established first ever state-of-the-art emergency operation center, and it's an all hazard, not only infectious, but others as well. And then, as I said, we started working for having units all across the country, which could feed back us with the proper and formal data. We started off just 2 and 3, and we kept increasing till we reached 20. And today, alhamdulillah, we have disease surveillance and response units in 155. That is the total number of districts in the country, which is definitely is a great achievement. It was very tough. And then the qualified person through the field epidemiology training posting, we requested the provincial and regional governments. They are posted there. And this training has been amazing, this field epidemiology training program. Now, then we started working on, you see these maroon dots, these depict that there were no public health lab at the provincial level. So we held up all the provinces and regions, and that's what I requested, the CDC grant we had. And out of that, we have already established, not only established, we have trained that manpower, we regularly monitor them, we have equipped them with all the, and these have taken the brunt of COVID PCR testing maximally at the provincial level as well. So as you see, I mean, they have, all of them are equipped with latest equipment, especially the PCR, and now they exist all across the country. And as far as at the central level, we have the high throughput now sequencers and even primer synthesizer with us. Now, what we wanted was an integrated model working at different levels. So it's the labs going in hand with the disease surveillance and response units. And then in the near future, as the vertical programs also come down under NIH, we would like to have more integration at the central level, because just to give you an example, what happens over here, once I took over the TB program, it was in a total mess with so many other issues. So I was basically given to clear up that mess. And almost 300 gene expert machine latest were lying at the storehouse for years and years. So we immediately started working and installing them, and they are equipped with software, and now more than 300 machines are working functional all across the country. And they have also been utilized for COVID testing through the cartridges that could be procured from United States. Now, this is the integrated model actually now existing on the ground, which gives the strength to the national government for picking up the data rapidly. And now we are working on the digitalization of and central integration with NIH, with the teams available at National Institute of Health. And that department is known as Tech, and basically that I established through a grant through Great Foundation a year back. This field epidemiology program, and some of you may be aware of, is a CDC-run program in 70 countries. And Alhamdulillah, Pakistan program is regarded as one of the topmost programs in the world. Every year, the Pakistani students, they do grab positions in various contests that are held within United States or outside. We have trained around 235, and we have again converted into a master degree program. The problem was the students completing at a huge worth as a certificate, but if you see the career pattern, so we converted it and into master degree, and they take the examination to University of Health Sciences Lahore, they clear and get the degree. And alhamdulillah, last year we got it internationally accredited, which definitely is a great hallmark. And I time and again, we were able to manage grants to CDC for continuation. Finance is something very, very important. And, once I joined, there were huge debts on NIH. We cleared those. We saved something. We could deposit it with the national saving. And for the first time in 50 years, I requested the Auditor General of Pakistan for a special audit, but no one would ask for such a thing at his or her institute. But alhamdulillah, we did it. And we regularly monitor all these. Then the pending rules and regulations, we have been covering all of them. We did establish a Department of Academics and Continuing Professional Development. We established an institutional review board and institutional biological committee, because there was none in and hardly any research going on. That's yet another area we concentrated thoroughly, and it has evolved. We have a team now which keep looking for international grant. We keep applying here and there, and time and again, we do get some grants. I got the ISO certification of the whole NIH done. And now we are moving on for the labs for ISO 15189, and for the drug division, we are going for 17025. We started a concept of high reliability organization and training with Fogarty International Center, NIH, and it's been very successful. Academics were not here, just the graduate of BSc Technology, but we got the MCPS reactivated. Now we would like to start the FCPS in microbiology as well because we fulfill the requirements. Started off the PhD because I brought my own PhD students over here. It's not a program with NIH, but definitely we are not an academic institute. So the students get enrolled in different universities. But what we favored was an internship for the students. Huge number of students. Even I've seen people coming from good universities in the country, no names, but having PhD degrees and with no practical output. So we started off, and what we do out of them, the best of the best we pick up for various projects within NIH. And as I said earlier, hardly any week whereby we are not conducting any workshop within or outside NIH all across the country. We started working on different legislative measures which have been missing for years and years, especially the National Infection Control Guideline, lab policies, biosafety policies. We drafted the biosafety legislation for Ministry of Foreign Affairs, the Code of Conduct, which has been revised. Fortunately, a decade back, I prepared the Code of Conduct for the life scientists, and it was picked up by the Ministry of Foreign Affairs at that time and became a national document, and we re-revised it now. And another venture that we conducted with the National Academies of Sciences is a good clinical lab practice document. And similarly, so many other things that have been coming. The missing was the CGMPs as far as biological production is concerned. So we did take care of that, and we finalized within this time. These are the ongoing projects to the courtesy of governmental funding. And why I am prizing you, because if you talk of AMR and integrated disease, they stand nowhere in this political arena. It's just to make them realize the importance of these things. It has taken a lot of our energies to convince them that these are the things where you need to concentrate. And the second thing is that what we have been doing is making a model, preparing the strategy, making it, trying to putting in all effort, making it successful, and then bring it to the government. We did this with antimicrobial resistance, fetching a grant of 2.8 billion pounds through Planning Fund, putting the things on ground, and then taking it to government. So the government is now funding. Similarly, the IDSR, which I'll talk shortly, and so many other things that are coming up. Now, the next important thing that, in my opinion, is coming is the feasibility for establishment of research and diagnostic lab at NIH. The initial feasibility funding has been approved, and we'll be shortly starting working on that. With all our efforts, the biggest ever I think the PC that has been approved by the government is the Integrated Disease Surveillance and Response. And that's based upon our 4 years experience with public health in England and actually implementing those things on ground and having DSR used all across the country. So now the government would be funding, and in that we would be establishing 36 public health labs in 36 divisions of the country. Now, this is going to be really amazing. And CDC has been pushing me because they are stopping the grant for this FELTP training. And on my request for the last 2.5 years, they have been extending. Now, alhamdulillah, this will be covered by the government. Just to apprise you about different vaccine studies which have been conducted in the past involving various bodies like WHO and others in 93, 97, 2003, and so on. But unfortunately, all were sent under the carpet, and nothing happened till the time I joined. We prepared a crux, and then we moved on with the vaccine production. The measles unit, unfortunately, was shut for 7 long years. So we rejuvenated, we started, rabies were not being produced for almost 1.5 year. We started restarted that. And the Sera production, as I already said, we enhanced in the previous plant. And this is the new Sera plant that I wanted to show you, which has been recently inaugurated. If you see inside, it's compatible with any international standard. It's a GMP qualified facility and ISO certified facility. And basically for the production of Sera, but we got it redirected to COVID vaccine co-production with CanSino Bio. Now, we are producing this quadrivalent anti-snake venom. This we started a couple of years back, and it's been highly appreciated at international level as well, alhamdulillah. The crux of the studies, and with all that, we prepared a model that we need to bring in the private parties for vaccine production. It's a costly affair. Government may not be able to afford it, and the technology keeps changing rapidly. So with all that model, we got the approval, and hopefully, inshallah, after this COVID, we have plans for bringing in much more as we have right now. Now, there was no occupational or patient safety set up for training or policy in the country. So we set up this first ever center by the name of COPS. And we truly want them to be like COPS. So it's a Center for Occupation and Patient Safety. It's fully functional. Throughout this critical period, they have been imparting hands-on training and even online trainings to different and institutes, and especially the hospital, in particular the IPC trainings. We started to gain momentum as well as communication is concerned. I had a new website, all the account, LinkedIn, Facebook, and we are very active on that. And we continuously float our advisories on those. We have so many national and international partners, donors, and one of the success indicators is all the local academic institute, they want to join hands for having good quality research. And so are the international donors. We've got a good number of international research projects going on at NIH now, and in collaboration with local partners as well. Just to apprise you very briefly, this was the actual state of the rooms if you had seen 4 years earlier. And then we started working. It was day and night and we never had funds, and it was only will, and we found the way, alhamdulillah. You can see the gallery and now being transformed right under the pictures. An old conference room converted into a new conference room. The outside, the galleries, you can see. Auditorium, you see the left side, I mean, the old auditorium would not hardly call it an auditorium. It was full of function, and the name was Bernie, Lieutenant General Bernie, the pioneer of the institute. So I did design myself and reconverted into an state-of-the-art auditorium, the Emergency Operations Center, the offices, the new offices, I would say. And then this is the new lab we recently inaugurated by the health minister. It's state-of-the-art lab. And we established the first ever zoonotic and vector lab for the country as well. And it's fully functional, alhamdulillah, now. This is the measles plant, the rejuvenated measles plant. Now, I would briefly touch, it's been a heavy mandate role and delivery all across the country during this COVID crisis. I would say that NIH has played the leading role in all the aspects, alhamdulillah. We are part and parcel of National Command and Operations Center. And during the early days, we devised the first ever dedicated COVID national action plan, which till today definitely is being modified. But we prepared and gathered all the guidelines and advisories, especially seeing the international model, taking in consideration the WHO sources. And just to let you know that we started off just 300 PCR tests at NIH lab. And we were even then the first country in the region to start off a COVID PCR because we could get those kits through China. And we standardized it, then we gave few tests to Shaukat Khanum and Agha Khan. And today, alhamdulillah, we have crossed more than 190 labs performing PCR tests with a capacity of 150,000 tests per day. On average, we have gone at the most to 60,000 a day. And but we never left on testing alone. We started a national quality control and quality assurance program, monitoring those labs. Hands-on training, even sending the teams over there. We use different lab assessment tool as well. And this is what the first time in the history of Pakistan that a mobile BSL-3 lab, alhamdulillah, was procured. And we sent our team initially to Taftan border. And till today, they are serving over there. But later on, we established a formal lab at Taftan border, which is one of the corners of Balochistan, if you see on the map. And alhamdulillah, NIH teams are performing over there. Now we have moved this lab to another city, that is Gwadar. And we are trying to procure such more labs. It's been an excellent and amazing experience, and they are in high demand now. We have been responsible for contact tracing and point of entry vigilance. We trained the central health establishment teams right on the ground. We have been helping them throughout at the airports and other, especially the ground ports. And throughout this period, as I said earlier, we never stopped any training. Quarantine, I think all this credit goes to NIH and NIH team that they prepared those plans, how to convert the hotels into quarantines and how to take on training the hotel staff and other staff. So lot many activity going on during this period. We started off with the genomics, nothing else, the whole genome sequencing for COVID, and today definitely we stand very steadfast where we are right now. We have had multiple publication, more than 70 have been submitted to international indexed high impact journals, out of which alhamdulillah 30 have been published. And that includes some very versatile projects like detection of COVID virus, coronavirus in sewage waters, and how long following that. And that was basically the idea came with the polio modeling that we are doing in the country. And similarly, so many other projects we definitely can share. And some of the projects we are doing with the international universities as well. Now, this, I would say, has been a huge success for the country, bringing in the first ever phase 3 trial for any vaccine in the country. We had 5 different centers. We had more than 17,500 candidates in that. And we tagged this one to the transfer of technology. And alhamdulillah, as I said, we were ready with the Sira plant. And I would like to make one thing clear that someone previously mentioned that it was not being, it was being utilized for anti-snake venom production. But side by side, we continued that. And meanwhile, one of the portion we dedicated it for packaging, formulation, and for corona vaccine. I wish you could come sometime soon and visit all these things. So the tagging really favored us for the transfer of technology. And basically what happens is we have officially launched the PARC vaccine. It's basically recombinant, as you all understand, adenoviral vaccine from CanSino Bio with a single dose. It's going to be very cost effective. And the best part is that NIH is going to earn for the first time in a public-private venture $1.5 per dose. We have already produced 120,000 doses. Now we are picking up with 900,000 doses. We have already started. And by the end of this month, we would be initiating 3 million doses in a month. And inshallah, I'm quite positive with all the efforts we are going to deliver back to the country. Now, this trial has opened doors. I mean, you cannot imagine the amount of pressure that I'm facing. I mean, right now, 4 or 5 Chinese companies, some Turkish, then we had an Australian and UK companies after us as well. So that's an area we need to concentrate. $1 billion industry totally neglected in Pakistan. We need to evolve a system whereby we pick up gear and do as many trials as possible in the country. But definitely there are certain requirements having top-notch bioequivalence and bioassurance labs. So these are the areas where we would like to seek your guidance. We did prepare the governmental funding project plan for that. Already there are 4 in the country, but unfortunately 4 of them are in the academic zone and they've not come up to the level where they should have been. As we have established a new ID hospital with a modular system at NIH. I got it recognized for clinical trials through DRAP. So that's yet another area where you can seriously think of having joint ventures with this hospital in the near future. Now, this is basically that hospital, and fortunately, I got directly involved because previously it was just an ordinary hospital, but I guided them for air HVAC system, the airflow system, the number of changes. So it is all compatible to the international standard alhamdulillah today. Now, moving beyond, as I said, one of the things is getting the international accreditation. Just to give you an example, ACRES, which is stand for Alliance for Clinical Excellence and Research and Safety, Washington-based NGO. I've been in touch with them for quite some time, and we would like to get our centers accredited with them, establishing a bioequivalence them. And some of the areas that, again, it's quite an earning potential is the biobank. We did make a plan with for one of the grants, which was almost on card before COVID, but we got caught up in this COVID. So we're just waiting how to go about this establishment of a biobank. The Center of Genomics we are establishing, we have made the major plan. One component would be the human, the other one would be the microbiological. We have already started working on microbiological aspects, and we have alumni procured a good number of grants, maybe smaller in number right now, like 500,000 through Gates Foundation, 100,000 plus from WHO, and now Public Health England would be coming up with in-kind for bioinformatic training, hardware and software. And similarly, we're looking toward the government for certain grants. I'm sure, inshallah, we will change the scenario. Just to give you briefly now, coming up to my last two slides. Now this is the new model of NIH, whereby now we have got new board of governors. It's going to be a totally autonomous body, and I hope so for that, because definitely there are many hurdles in the bureaucratic channels. And I think it has taken my energies convincing them and getting the things out of them. And I'm sure with the presence of Dr. Zulfikar Bhutta as the chair of the new board of governors, things would be changing very, very rapidly. Just to give you briefly, a CDC would also be established underneath national. Now it's going to be National Institutes of Health, and we'll be having 7 different centers or institute, including the CDC and our existing field epidemiology division and some other departments like vertical. I'll show you on the next slide would be merged with this one. The previously redundant, I would say, Pakistan Health Research Council, which was earlier known as Pakistan Medical Research Council, would come under NIH, and I'm sure this will totally change the focus of medical and clinical research in the country. And there are certain other redundant departments which I have requested time and again to the government to put underneath that. The second thing that we would like is the clinical trial registration is right now with the DRAP, and Dr. Azan and some of you will bear me out how difficult it has been for you for enrolling. And this is definitely, I would say, it's a conflict of interest that a regulatory body endorsing the trial or registering the trial. So we have requested that the clinical trial registration should come under HRI. Monitoring may rest with DRAP. Then there's going to be Institute of Nutrition and Health. Our drug division and traditional medicine would be comprising of the Drug and Alternate Center, and the Food Nutrition Center would be comprising of the Nutrition division, and we are requesting for merger of the Department of Nutrition as well, as you can see. Then there's going to be Health Data Center. Right now, we established a tech, and it's again quite a qualified expert, number of qualified experts we have already, and they've started working on so many things. Similarly, Center for Environment and Occupational Health, our COPS will be merged with this one. The National Health Lab, this is a very well-developed area, and we were going to further nurture it with expertise and research work as well. Then the last one is the biological production, and we would gather it again as a separate center. And it has strength because this is an earning body of NIH. And very briefly, what CDC is going to look like is we'll be having the Center for Infectious Diseases, all the existing program, the vertical program, and One Health concept would emerge with this one. A non-communicable which exists with the ministry would be shifted to NIH, inshallah. Just waiting for the orders from the Board of Governors. I'm going to do it. Center for Training and Professional Development, inclusive of field epidemiology training and all other which we are doing. Then Center for Public Health Emergency Preparedness and Response, whereby different departments would be covering. We are also the focal point for CBRN and biosafety and biosecurity. So definitely, we requested the government, the redundant units like APPNA, which is National Health Preparedness Emergency and Response Network, and the EOC should come down under NIH. Let's see what happens over here as well. And just to tell you briefly, these are the different, final is the Center for Public Health Safety, which would comprise of CHI, and CHI is the Central Health Establishment looking after the points of entries, and EPI as well. Now, the way forward, definitely, we have the present shortage. We have joined all the existing strength. We have tried to fill up the group in whatever difficult situation, whatever humble rupee or dollar we could get. Frankly speaking, I tried to convert it into $2. The strengthening of the existing system, definitely, and governmental support and facilitation, we look towards the international donors, and we definitely try to grab as many research grants as possible. Now, with all this scenario, what we are looking forward is coming up towards basically enhanced capacity, technical development, which we have done to a larger extent as far as NIH is concerned. And all this will ultimately culminate into increased output, which we have done. But definitely, as we move on, there is always a huge room for improvement for a country like Pakistan. And definitely, we look forward to that under the new Board of Governors. Just to conclude, NIH is a national asset, and I truly believe that. I mean, if it could deliver for COVID on all fronts, why not on the other fronts, inshallah, and it will do it. It has enormous potential. The team has been rejuvenated. We have developed enhanced capabilities. We can contribute toward the SDGs, and we want to serve the country. We are serving. We'll keep serving, inshallah, our lovely homeland. Thank you so much for your time.
Thank you, Aamer. This was excellent, General Ikram. I think we just need few more people like you, and country can go to the next level. We have some of them here, Dr. Bhutta, Dr. Abdullah. But thank you so much. This was excellent. Many of us actually didn't know exactly what NIH does. So that was a good understanding and explanation of everything. We will take next 15 minutes or so for questions. And a lot of questions actually came from Danish, who is our merit chair. So since conflict of interest, I'll read some of his question. What is what is the research budget for NIH? Danish, you want to ask yourself, or I ask your questions? Maybe he left already, he has to go somewhere. So what is the research budget for NIH? What is the funding pathway NIH has and vision, but which you gave most of that, I think.
Right, I will let you.
Yeah.
Yeah, thank you so much. Thank you, Dr. Anish. Very pertinent question. You know, we get not even a single penny for research as far as NIH is concerned. What we have been doing before my arrival, there were hardly any research work that was going on. In the last 4 years, what we did was primarily I prepared a team now, which will be converted, I'm sure, with the new body on top of us. We would like to convert it into a department whereby I got them trained to different international agencies, especially the Fogarty, John Hopkins, how to trace international grant. We look forward toward international grant for research. And then as far as Higher Education Commission is concerned, yet another development that has taken place commendably under Dr. Bhutta is basically a huge number of research grants. So what we do, we apply for research grants over there. We apply for international grants. We've got good number of grants, as I said earlier, that we are working upon. And then definitely there are certain donor-funded grants. This mandate rests with actually Pakistan Health Research Council. And Alhamdulillah, after a very long time, the government realized that PHRC would not be able to deliver this mandate. Either it should do the research or it should take care of the grants. The budget that they used to get, around 400 million Pak rupees, was basically mostly utilized for their pays, and what they could, what was left was just hardly 100 million for dishing out grants to all parts of the country. Fortunately, I could be the chair for just 3 months alone, and in that we re-strategized to how to give grants, and that document we're going to share that. So this mandate would be resting with the PHRC, which is now would now be known as Health Research Institute under NIH, and they would be getting the governmental funding for dishing out the grants. But meanwhile, as far as we are concerned, I've got some good number of my personal grants as well. But what we are doing at the national level, good number of, and there are two components. One is the research grant, the other is donor-based targeted approach grant, which we have. Because I've been working with Fogarty and so many other institutes, we have got a good number of such grants as well.
So that was, and many of the question actually panelists were asking or were asked to panelists. One of them, I think you already answered many of them. One of them is like, you answered in the end a little bit, but Center for Genetic Studies. But my understanding or our understanding is any genetic study, you have to send the test outside the country. But yes, I think you are working on it almost there.
Yes, this has been a routine, unfortunately, for years and years. Even NIH was sending the sample. Alhamdulillah, we have got all latest high throughput NGS equipment now at NIH. Just to share with you, I mean, I could grab $2 million from Gates Foundation. 1 million we dedicated for the digital side, and 1 million we dedicated for the lab side. Now, out of that, we have all the facilities now under one roof for the genomic surveillance, NGS, and all those things. And now, based upon that performance, I prepared a paper. We have taken some of the very important international donors and institutes, like we are working closely with Fogarty, NIH America, John Hopkins, Public Health England, and CDC America for joining the strength, getting the grants. And then we have forwarded another grant from the governmental side as well, based upon that model, successful model. And we're quite sure, inshallah, as we move on, there will be a separate genomics center at NIH for which we have done the groundwork.
Thank you. So Uzair or Shahid, any comments or question? Or Dr. Hamid Merchant?
Well, thank you very much, General Saab, for the nice overview of NIH, and it's been very nice to see how NIH has been evolving over the years and what the modern developments are. Many people have not seen NIH making all these progress, which has been just shared by you. So it's very nice and very pleasing efforts from the NIH to grow that far. And we would like to see NIH go further and recommission some of the services which were decommissioned before and did not evolve. Would you like to explain to the people a bit more about NIH current role in manufacturing all those antivenoms and seras and capabilities that you have, and the one you resume now, which have not been functional before?
Right.
And what do you see the future in that direction?
Right. See, there are two components. One is the anti-sera, the second was the vaccine. Right now, the anti-sera component stands the governmental responsibility in the public health domain. And with all that in mind, 4 years earlier, once I joined and realized some of the anti-sera plants had gone very old, and they could fulfill only 1/5 of the country's requirement. And there was a huge burden because they stopped production of anti-rabies, anti-tetanus, and anti-diphtheria. And it was only anti-snake venom. So we started working. Just to give you a brief, we tried to knock on all the doors, and I'm going to do with all of you as well, inshallah, in the near future. We send our teams to Australia for trainings, especially for quadrivalent. We could manage a grant from there as well after that long training in Australia. And meanwhile, our new anti-sera plant, as I said, a very strange history starting in 2004 and completion in just a year back. We can fulfill the country's requirement, inshallah. I mean, it has the potential to fulfill country's requirement. So this is amazing. We are strategizing that if we could manage at our own, because this is an earning source, the government sets our rates and they're very nominal. I mean, just cost to cost basis with a very slight profit. So I think with the new board of governors, one of the points that we'll be taking this, increasing the price so that we earn, we buy, we make more, and we dish out. And then the chance of exporting. I mean, some time back, there was a demand from Philippines, and we could not fulfill because we were not able to fulfill our own country's requirement. So with all that in mind, the target is definitely thinking much beyond going down to the export level. As far as the vaccine is concerned, as I said, it was very difficult. It just took 1.5 years to get the governmental nod for public-private venture. And similar amount we have already wasted because the Chinese government, they came down for donation of polio vaccine some time back. And I requested them that there's just one aspect that you give us the polio 30 million vaccine doses. I would be more keen to having transfer of technology. It was agreed. 1.5 billion Pak rupees grant has been approved by the Chinese government. We have got all the governmental approvals. And this is yet another point I'm going to discuss with the Board of Governors very soon, that they need to facilitate us. Why are we wasting time in this? And what I requested them, because it's going to be an oral polio vaccine plant. 2 years down the line, it finishes, then the IPV comes in. So it should be converted into IPV. And once polio is finished, it should be a modular system so that we reutilized, as we just did in our new plant for vaccine. So there are multiple strategies. And before COVID, we did advertise in the newspaper. 11 companies are already in hand, including biopharma from Indonesia. So we are quite sure that in the near future, and you are one person which we have targeted heavily in this area. So we're not going to, as I said, I'll keep knocking your doors in any case. Thank you.
Shahid, any comment, or Mustafa or Uzair?
I will yield my time to, I think, Dr. Zulfikar Bhutta, who is, I think, chair of the board of new NIH, to listen to his insight. But any other panelists have any question, please go ahead.
Dr. Bhutta? Okay. Maybe we'll take Mustafa. Oh, here is Dr. Bhutta. Yes.
No, I didn't want to say very much. I thoroughly enjoyed this presentation, but I'll yield my time to others who want to learn more about the NIH.
Okay. Mustafa, you have a question?
Thank you very much, General Aamer Ikram. This is Mustafa Siddiqui. I think in Army Medical College, I think I'm probably 3 batches junior to you. So good to see you after a long time. So my question was that how can the Pakistani diaspora be in different areas in the world, in different specialty, can help you achieve your goals? And I also want to congratulate you in achieving so much in so little time. So kudos to you and your team. Wonderful job. And as it is said, that never waste a good crisis. So COVID crisis actually has given us so many opportunities to improve our systems and to develop clinical trials. So yeah, I would love to hear your comments. Thank you.
Yeah, thank you so much. I mean, so many out of you are already in contact with the NIH, my teams, myself as well. And I was just before this, I was just starting, we started a little bit of discussion this before presentation. You see, so many good people like you who want to bring back something to the country in one or the other form, whether training, whether they want to start off something. You don't get the response, unfortunately, equal response, right? Most of you come down here, you get disappointed. Recently, there have been examples, people coming back from America, disposing of all their things, and then they definitely don't get the facilitation over here. Well, I do understand there are so many issues and problems over here, and over the years, probably the mindset has also been on the rusty side. So I take it as it's our duty to facilitate you, whichever area you want to function. There was so many examples we can share and separately discuss that how we can put the things together. But I think in the near future would be the combined collaborative research programs doing together, whether through APPNA, whether individuals, and incorporating NIH, AHRI, especially the Health Research Institute, with your program so that they remain part and parcel. That will uplift their activity in the near future. And not only that, they will start getting the real expertise and training at their end, but definitely the combined projects, and then they can act as a facilitator for you. It's some neuro-related project, it's some gastro-related project, it's some diagnostic-related. So we should be the entity guiding you to the right team, matchmaking, in other words, I would say. And that matchmaking, we also be the part of that project as well. This is what I've successfully done with so many international institutes before even, but NIH provided us the opportunity and platform, and we could do it in a much more amicable way. And we, inshallah, and once we establish this R&D center, definitely we're going to float all the TORs and everything. Where would you like to help? And that will be yet, inshallah, another opportunity.
So I think we will take 2 more comments, one from Sarwat, Dr. Sarwat, and one from Ubaidullah. And then General Saab has things to do, so we'll cut it off at 1:05, 5-minute delay. Sorry. Go ahead, Dr. Sarwat. You are muted, Dr. Sarwat.
Assalamu alaikum, General Saab. Great presentation, lot of achievement. I just wanted to find out about the quality improvement. I know you have a quality improvement cell and you are following ISO. I have noticed that in Pakistan, we need our own system of quality improvement, not following the international landmarks and international societies. And the reason is that majority of our healthcare deliverers do not understand English language or concepts in English. And all the literature in quality is in English, which even many of the doctors cannot conceptualize, but would not admit to it. So, and our healthcare seems to be focused towards the well-to-do people more than the people in the villages who require attention as well as the quality of healthcare, which they receive the poorest quality. So उस बारे में आप कुछ फरमाइएगा डॉक्टर साहब, प्रोफेसर साहब, जनरल साहब, क्या क्या आपके टाइटल में कहूँ?
आमिर जी है। मैंने बताया था अपनी डेफिनेशन मैंने पहले बता दी थी, मैं मजदूर आदमी हूँ जी।
नहीं सर, you're mashallah, great job. So I'm extremely interested in healthcare quality, particularly for the common person in the villages. And what the NIH is doing about it. Thank you very much.
Thank you, Doctor.
Thank you so much. You've raised a very important question, definitely. Now, this concept, some time back, did a project with, again, NIH America. And later on, what we realized was conversion. That was more so lab training and all those. So got converted not only into Urdu, but different languages. This definitely is a gap. And I think communication is something very important. Up till now, whatever we have done, we tried to convert it into Urdu and publish it as well. And I think that has really made a difference. The second thing is that if you see the education now, the lab technician and other, definitely they are coming up as graduates now. That is really picking up the momentum. So if you see the student which were there at FSC level some year back and now coming up as graduates in different fields, definitely, and with the availability of net and so many things, there has been a tremendous difference. But that still there is a huge chunk which may not be understood. So as far as NIH is concerned, we try to translate all, even with so many international agencies. We have done that we translated their guidelines and policies into Urdu for a common man and to understand. The second thing is quality in relation to different aspects of whether it's the testing, whether it's vaccine production or other things. For that, I mean, just to give you one example, got the CanSino Bio transfer of technology for quality control. It was much tougher than I thought. When processing, the rest of the things, frankly speaking, we did amicably and easily. But coming down to quality, and for the first time, I stood with my team for each and every test for hours and hours, because it was amazing. I mean, the quality for different steps, monitoring them, whether it's lab, and we have started a national program as far as lab testing, not only for COVID, but for others as well. And then the final system is for all the qualities, and we started off a feedback system, whether we are training someone, और ये हम उर्दू में बोलने लग गया कि हम इसलिए कि जो anyone who could not understand, we take care of them. It's been tough converting them into other language, but Urdu being a national language, we have done sufficient work in the recent past.
So last comment by Abadullah, and then we have to let our speaker go. So Dr. Abadullah Malik, thank you.
Thank you very much, sir. And just a very quick comment, and that is, if anyone wants to see the true sense of paradigm shift, then I will recommend to come and see the NIH. Thank you very much.
Okay. Well, Dr. Uzair, any comment, or we're good to cut?
Thank you very much. So I have just a small question. So we will be discussing about taking care of vaccine, sera. There is a big market of in vitro diagnostic. So is there any policy in the pipeline to support the local production of in vitro diagnostic? But we have seen during the COVID time, we had to be totally reliant on the international countries for the import of all of these reagents. And I think there is something going on at NIH as well on that thing. Just small comment, please.
I think Dr. Zaid, he's a great guide, by the way. I cannot say what he knows is much beyond me in these fields. We now have approval of a technology park within NIH, and one of the main areas that I requested with the PM Secretariat that we would give this land, provided it should be thoroughly utilized for vaccine production, biosimilars, so many other biological products, and it's a huge chunk of market. We have done a lot of spade work on different aspects right now, and I'm just waiting that as soon as the board fully equips with different things, rather even yesterday, I was preparing a paper for them to be submitted. So as soon as we start getting the approval, we'll be dishing out. And this time we will go to the international market as well. Just to give you an example, we're not leaving anything, we're not tilted that we are doing the thing toward the Chinese side. We have given our interest to WTO and WHO for messenger RNA vaccine as well. And let's hope that we grab that opportunity. We bring the country to a level where it should have been years and years back, inshallah.
Well, with that, thank you so much. This was amazing. We know a lot more about what you are doing and what NIH is doing. All I knew when I was a medical student in Pindi that NIH does some allergy testing, that's it. But that was a long time ago, like about a zillion years ago. But anyway, so thank you so much to panelists and General Ikram, and hopefully we all be in touch through emails and WhatsApp and whatnot. Thank you, and we'll see you next week.
Thank you. Thank you. Assalamu alaikum.